So thank you everyone for coming this morning and listening to my talk. I'm going to be sharing some of the research that we've done recently exploring attentional strengths and challenges in both neurotypical toddlers and toddlers with confirmed diagnosis of autism, or toddlers who are kind of on the wait list to see if they may meet diagnostic criteria for autism. And so I'll jump right in. When we think of attention, we can really think of it as a hub faculty that helps promote learning. So one form of attention that I'll be focusing on in this talk is visual attention, which is basically using our eye gaze to help us pick stimuli to look at and to make sense of the world around us. So for example, when you look at this image here, this is one of the tasks that we do in the lab. You can see me and you can see my daughter, Eva, who was a participant in a different research study that also used this task. And this is the examiner that's doing the task with her. And so within this environment, it doesn't look overwhelmingly visually stimulating, but there is a lot to look at. So you can see here, Eva is pointing at the book and she's making eye contact with Sana. But you can see there's lots of things that she could be looking at here. So with attention, she has to decide if she wants to put her attention on the book, if she wants to put her attention on Sana, if she wants to put her attention on her mother, or if she wants to look at something else in the room, because there's colorful foam blocks here. There's posters all around the room on the walls, which are a part of the task, of course. And so there's lots of things that she could choose to put her attention on. Or because she's a kid, she could also choose not to cooperate at all and just close her eyes and pay attention to nothing. And so within this, then, after she decides what stimuli she wants to attend to, she's going to look at Sana and check in to see if Sana is paying attention to what she's doing. So she's maintaining her attention on Sana. And then what she can do is she can disengage her attention from Sana. So look away from Sana to look at something else. And you can see she's looking at the book. And then she can alternate her attention between looking at the book and looking up at Sana to make sure that Sana is looking at the thing that she's pointing at, which is the picture in the book that she wants to share. And so within this realm, you have to pick a stimuli that you are interested in. You have to maintain your attention on that stimuli. You have to be able to disengage your attention from the chosen stimuli to look at something else if something important comes in the room. So you can imagine some of these abilities are really important for learning things, because being able to disengage your attention would be very important if, say, you're playing on your phone and someone comes in the room to deliver a really important message to you, like, we have to leave right now. If you're not able to disengage your attention, you're not getting that important stimuli coming into your brain to process. So one of the reasons that our group was really interested in in attention is because attentional challenges have been widely described in autism spectrum disorder. And differences have been reported as early as the first year of life. And often these differences, when they're reported before age 1 and sometimes before age 2, it's by parent report. So parents will fill out questionnaires and they'll, be asked questions like, does your child have trouble paying attention? Does your child have trouble responding to their name and things like that? And so parents will report some differences in the children that later go on to receive that autism diagnosis. And as I mentioned, being able to modulate attention, and I only talked about 4 aspects of visual attention. So you can imagine how being able to modulate and maintain this type of attention could be important for learning new skills, being important for learning early language development, being important for, school success and being able to pay attention to the classroom and focus on what the important topics are. And of course, it's also important for initiating and maintaining social interactions. And so with attentional interventions, there are some that are out there in the literature, but they're more suited to preschool and older children because often they come with pen and paper type tests. Sometimes they involve children having to be able to follow a set of rules. Sometimes they come with having to be able to read instructions. And so some of these things are a bit advanced for very young toddlers. And so we were interested in exploring something that doesn't require any of that stuff, which is using eye tracking as a method, which is why I was interested in doing visual attention. So what's really great about using eye tracking as a method for exploring attention is that we don't have to give kids any instructions. It doesn't involve any movements of the body except for the eye movements. It doesn't involve any head movements, and it doesn't involve any pen or paper testing. And I think this is really great for children. So what we do is we just put them in front of a computer screen that has a program, whether we programmed in MATLAB, and it just tracks their eye movements as they look at things on the computer screen. And so the purpose of the research I'm going to share with you today is that we were interested first in looking at if there were any differences on 4 types of attention between otherwise neurotypical toddlers and then toddlers with suspected or confirmed diagnoses of autism. And then after looking at if there were differences between neurotypical and autistic toddlers, we were really interested then in exploring, well, can this technology, if it's able to find differences, can this technology then be used to perform some kind of attention intervention with autistic toddlers? And can that attention intervention impact those measures of visual attention that we're really interested in exploring? So as I mentioned, all we do, this is kind of what our setup looks like. So the computer here runs the program on MATLAB. And we had this giant tent that we had in a room that was basically just designed to remove all the other distractions. It was just white, boring walls, very low lighting inside the tent. And you can see we have this chair here that the parent would sit on, and then the toddler would sit on the parent's lap. And then they just paid attention to this computer screen. And so various videos and stimuli and things like that would appear on this screen. And then the eye tracker, which you can't see, but it's a tiny little black bar that runs along the bottom of the computer monitor, just tracks the eye gaze of the child. And to make sure we were only tracking the child, we had parents wear super cool infrared goggles that blocked their gaze. So we were able to make sure we were only tracking the child's eye movements. So within the first part, which is looking at differences in visual attention, we decided to go with 4 different tasks. And I'll take you through each of these tasks to give you a little bit more background on what specifically they were looking for and what we were measuring. So for the first one, sustained attention. So with this one, we had 4 different pictures. So 2 of them were considered interesting. So the first one was, a picture of kind of like aquarium. This is the exact pictures that we use. So the first one was this kind of aquarium picture. And the second one was also interesting and complex. It was like a field of multicolored flowers. I think it had butterflies in it too. And for our 2 boring ones, it was just really these white backgrounds with one image. So the first one was this kind of gold colored cross. And the second one had just a circle of black dots. So not visually interesting at all. And so what we were measuring for sustained attention was 4 different things. So each of these images were interspersed throughout this assessment that I had, and each image was shown 5 times. And so what we were interested in measuring then was the shortest amount of time that a child looked at the image. So that could be from 1 second all the way up to 120 seconds, which is the length of each image, maximum out. The maximum amount of time they looked at, which again can range because it could be different for a child, but it go up to an upper limit of 120 seconds. And then over those 5 looks at a particular image, we looked at the average amount of time that they looked at that image. And then also we measured the range of looking, which would be the maximum amount of time they looked at the image subtracted by their minimum amount of time that they looked at the image. So we were looking at 4 different measurements of looking duration, or how sustained their attention was on this task. And I just want to show you what these look like. I just have a little picture over the participant here to keep their privacy, of course, but it's literally just a still image. So the video is super exciting because literally nothing is happening because it's just a still image. Okay. And then for the interesting stimuli, again, it's not super exciting, but it is just literally a still image. We would have, so that was between a trial. You can see like when they look away, we would start a new trial. So you did actually get to see something in that one. Okay, I'll just pause that. And so with these pictures, though, we did have some really light music in the background, which I cut out here in case the parent or the child said something, because I wanted to make sure we kept their identities blinded and protected. So it would just be like instrumental music, no words or anything like that. So the second task that we did is called cognitive control. And this one is a little bit more complicated. So this one is kind of like rule learning. So what you can see here, we have a Peppa Pig image, and it's actually going to be a video. And so what happens in this task, and you'll get to see it in the video, is that a flower will appear here in the center on the screen, and then the child will decide if they want to look to the left or the right. And then depending on where they look on that first rule, the Peppa Pig image will appear, and it'll play a short video where, you know, Peppa gets jealous because George is amazing at skating and she is not so great. And so then that'll play for, I think it plays for about 10 seconds, and then the video stops and that little flower thing appears again. And then the child gets to decide if they want to look to the left or the right. The difference here is that now the rule has been enacted. So if they chose to look to the left first, the video will only start playing once the child looks to the left. So if they look to the right first, nothing will happen. But then they'll look to the left and the video will start playing. And so what we do here is we measure the number of times it takes for them to kind of learn that rule. So the number of looks to the correct side, and then the proportion of looks to the correct side. And with this one, it gets a little bit also more complicated, because halfway through, so at trial 11, I believe, then the reversal happens. So if they originally had learned the rule that they need to look to the left, at trial 11, it just switches to go to the other side. So we'll say the right. And then the child has to relearn this new rule. So how long it then takes them to learn to stop, not go to the left, but to go to the right. So we're measuring the number of time it takes them to learn that first rule, and then to learn the new rule, and then the proportion of correct looks during the first time they learn the rule, and the proportion of correct looks when they have to learn the new rule to look to the other side. And so this is what that task looks like. So you can see that they've selected to look to this side. And so the flower appears, then they have to decide to look either to the left or the right. And there's a little delay because the child has been looking to the wrong side first. And you can see that the video starts playing a lot faster because they've picked up the rule. And then I wish I had done a little bit longer so you could have seen the rule reversal, but maybe one day in the future, if we show some follow-up data, I'll be more mindful of that. So the fourth task that we did is called disengaging attention. And this one, I think, is a task that is commonly used in the autistic population, but this task really is about being able to look away from a stimuli that you're selected on to look at something else. And so what's important about this one is that it always starts the same with this central stimulus, which is this colorful little ball appearing on the screen. And then once the child looks at that central stimulus, one of three different things could happen. So first, what we call the baseline trial is that if the child looks at that central stimulus, the central stimulus will disappear at the exact same time as that peripheral stimulus appears. So this will disappear immediately as this one is appearing. For the gap trials, when the child looks at the central stimulus, it will disappear first, and there's a 200 millisecond gap before the peripheral stimulus shows up. And that is to serve the purpose that with the central stimulus disappearing first, it kind of frees visual attention from being fixated on the ball. And then we're able to measure without anything being fixated on how long does it take for them to look to the peripheral. And then the overlap trial, what this one is the central stimulus is on the screen, the child is looking at it, and it remains on the screen the whole time that the peripheral stimulus appears. So this one is with attentional problems, or attentional challenges rather. This is the tricky one, because then the child has to voluntarily disengage from that colorful ball to look to the peripheral stimulus. So it measures three different ways that visual attention and disengaging attention might be impacted. And so what we're really interested in here, the key measurement, is then how long does it take for them to look from the position of the central stimulus over to the peripheral stimulus. And presumably, if they're having disengaging attention challenges, the overlap trials should be longer because they would have difficulty disengaging from that central stimulus. And so this is what that task looks like. And if you watch closely, you might be able to see a couple of the different trials. So you can see that was overlapping, 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 disappeared. Is that the end? That's the end. Okay. So there's a couple different trials, and it happens really rapidly because eye movements can be super fast. And so finally, the fourth task that we looked at is the joint attention task. And so in this one, we're really interested in measuring both initiating joint attention with the examiner And then also responding to joint attention bids of the examiner to the child. So when we're looking at initiating joint attention, we're really interested in looking at the child making eye contact with the examiner, and that could occur just with eye contacts, or it could include both eye contacting and pointing. And now when we're looking at responding to joint attention, what this is looking at really is the child's ability to follow where the examiner is pointing. And so in this task, if say the examiner is pointing in the book, they'll just point without saying the child's name or giving them a cue to look at the point. And then we just measure if the child follows the examiner's point, either at the book or as you can see here, Eva is pointing to one of the posters. So one of the other tasks, I think you can't tell here, but Sana is using kind of a short arm point to point at the poster. And then Eva looks at it and also points at it to show, I guess, to show Sana that she is in fact attending to what she would like her to look at. So I have a little clip here to show some of the eye contacts. And this one does have audio. I just want to let you know that. So you can see she's looking from the toy to Sana to let Sana know that she's interested in the toy and also interested to see if Sana is also looking at the toy. So we've got some good initiation of bidding there. Okay. And so now I'm going to jump into, so now that you know the measures that we use for this study, I want to jump into the participants that we recruited. We recruited otherwise neurotypical toddlers that, we did our screening with, and they didn't have anything to make us think that they may have features of autism. And so we recruited 19 children in the neurotypical group, and we had 23 toddlers in the autistic group. We wanted to have them perfectly matched, but as we were nearing the end of this study, COVID happened. And so we kind of worked with what we had at the time, but we were working towards matching one-to-one for age and sex at birth, to have them match, but we ended up with this. And so we got, you can see that when we did this assessment with him, they were just over 2 years old. The group was on average 25 months, and the ages range from 18 months to 34 months in the neurotypical group and 18 months to 31 months in the autistic group. And you can see that they did not differ on weight at birth or gestational age. We did find some differences in the mother and father's ethnicity or race, though. You can see that the neurotypical group were by far more Caucasian than they were BIPOC. So when we did our analysis with this, we included ethnicity as a control variable to make sure that the differences we were finding were being more driven by the autistic phenotype than it was the ethnicity of the child. We also compared education, mother and father's education, but we didn't find any differences on there. And I chose not to add that because then the table gets really long and cumbersome. And so I wanted to make it more visually pleasing. So we also did the ADOS and the Mullen to look at the developmental and the features of autism to ensure that we were, having kids in our group that met the criteria of that group. So as you can see on the ADOS, which is the clinical measure that we use often to help with the diagnosis of autism, you can see that the autistic group were significantly different from the neurotypical group, which we expected. And we also did a developmental measure with them called the Mullen, and it looks at things like visual reception, fine motor skills, receptive language, expressive language, and then it has that early learning composite, which is kind of like a summary score for all of those scales. And we found that the autistic group, again, showed some differences on the Mullen. And so when we were doing our analyses, we included this as a covariate factor as well, because again, we wanted to make sure or try as best as we could to ensure that the differences, if we found any on these measures, were being really driven more by the autistic phenotype than by their developmental level or by their parents' ethnicity. And then we also had the parents complete a questionnaire which is the process, and the acronym is escaping me right now, but it measures social communication, and it was formerly called the APSI. And so we found that parents in the autistic group were also endorsing many more items than parents in the neurotypical group. So on our 3 screening measures that we used to ensure the kids were in, meeting the criteria for that group, it did appear that they were a good fit for each group. So what did we find? So first I want to talk about that face-to-face task with the eye contacts and pointing. And so what we can see here on this side is the initiation of joint attention, which is where the child makes eye contacts, the child points to get to, interest the examiner in what they're looking at. And then also within that, we also counted bids to caregiver. So if the child, for example, pointed at a book and then looked to their parent to see if the parent was sharing the attention, we also counted those as well. And what we found is that the neurotypical group here on the left side of the screen and the autistic group on the right side of the graph here, we found that when we measured the total number of eye contacts as shown here in this purple bar, the neurotypical toddlers were making many more eye contacts with the examiner than were the kiddos in the autistic group. Although it looks like they were making more points, it wasn't statistically significant, but we did find that the kiddos in the neurotypical group were making more bids to the caregiver than the kids in the autistic group were. So there we did find some differences in initiating joint attention, which wasn't too surprising because there's lots of literature suggesting that joint attention, and these 2 are measures of joint attention, are different in autistic toddlers. And so now when we look at the responding to joint attention, we can see here that we were looking at the child responding to those points that I mentioned. So in the purple bars, we have them responding to the pointing in the book task that you saw in the video, or in the picture rather, the book in front of Eva. And then we also have responses to near posters. So the near posters were just directly to the side of the toddler. And then the far posters were behind them. So to respond to those, they'd have to actually turn around to look behind their back to look at the posters on the back. And so what we found there is that when we're looking at the book task, although again, it's like trending where it looks like neurotypical toddlers are responding more, when we did the statistics on it, it wasn't coming up as statistically significant. But for the poster task, both the ones that were near to them and the ones that were kind of behind their shoulder or far, we were finding that the neurotypical toddlers were more likely to respond to those points than were the autistic toddlers. So they're making more eye contacts. The neurotypical toddlers tended to make more eye contacts and more bids to the parents, and also tended to respond more to the poster task. And when we look at that sustained attention task, which is those pictures, like the interesting fish pictures versus the more boring monochromatic pictures, what we found is that on the boring images, the autistic and the neurotypical toddlers didn't differ at all because they were super boring and nobody wanted to look at those, which wasn't too surprising. But when we looked at the interesting images, we did find some differences again. So we've got the time in seconds here on the y-axis for how long the children looked at the picture. And we have our 4 different measures that we were measuring: the peak look or the maximum look, the mean look, which is the average of the 5 looks across the images, the minimum look, which is the least amount of time that they looked at an image, and then the range, which is the peak look or maximum amount of time, subtract the minimum amount of time. And what we found was on all the measures apart from minimum look, the autistic and the neurotypical toddlers did differ in that the autistic toddlers tended to spend more time looking at the image than did the neurotypical toddlers. On the other test that we looked at, which was the gap overlap task, which is the one about looking away from the central stimulus to look to the side, and then the other one, the cognitive control, which is the Peppa Pig task, we didn't find any group differences on those tasks when we controlled for the developmental level and the ethnicity of the parents. So that was a little bit surprising because the literature suggested that at least on the gap overlap task, we might find differences. But we also realized that on those tasks, our toddlers were older than the kids that are in those studies. So age may play a role there. So now that we know, or that we found that our attention assessment, if you want to call it that, was able to find differences between neurotypical and autistic toddlers, we were really interested then in seeing, okay, well, we have this intervention with our collaborators in the UK that they've used with just typically developing less than 1-year-old infants. And they found that it was able to make differences on, show differences on attention in the neurotypical toddlers. So we were interested in seeing if it would have an impact on our autistic toddlers. So in this one, we had a randomized controlled trial. And so what we did here is we recruited toddlers that had confirmed diagnoses of autism who were suspected to have a diagnosis, so who were kind of on a wait list to get assessed. And what we did is we brought them in, and they all did those same 4 attention tasks that I showed you before. So the sustaining attention, disengaging attention, cognitive control, and then that joint attention task. So they all did that. After they completed that, then they were randomly assigned either to an attention intervention or randomly assigned to our placebo or control. And this intervention was just 4 weeks. And then after they completed either the attention or the placebo portion, they then did that attention assessment again at the end to see if being in the intervention had any impact on these measures. And so I'm going to take you through what the intervention or the placebo looked like. But first, I'm going to tell you about our groups. So we ended up recruiting 69 rather toddlers. And again, COVID kind of interrupted this study. So we kind of had to get cut off at 69. And so through just random assignment, of course, they were split fairly evenly. So 35 of them went into our control condition, 34 of them went into our attention training condition. And they were on average 25, 26 months. So not a lot older than the kids in the previous study that I just described to you. And you can see when you look at the statistics here, they didn't differ by age or sex at birth or birth order. So if they were firstborn, secondborn, thirdborn, they didn't differ on the order of birth. They didn't differ on if they had an older sibling that was diagnosed with autism. But again, we did find, oddly enough, that we did have differences in mother's and father's ethnicity. So you can see here, it's not as drastic as it was in the other study that we did with the neurotypical toddlers, but it was still significant. So this was included as a covariate in this analysis as well, to make sure, of course, any results that we have are being driven by the training and not the ethnicity of the parent or the child. And then we also did those same measures again. So we did that developmental measure that looked at visual reception, fine motor, receptive language, and expressive language. And then we also did that observational ADOS that helps with the diagnostic process. And we did that parent questionnaire, whose name I wrote out this time. So that's awesome. So that process stands for Parent Rated Observation of Communication, Emotion, and Social Skills. And that is a lot for me to remember at 8 in the morning. So past Lori was really nice to me by writing that out. So what you can see on this, the ones that are shaded in the light gray are the ones that were significantly different. So there was no differences on visual reception or fine motor, but we did find differences on receptive language and expressive language between the kiddos that were in our control group versus our attention group. So we did also include language as one of our measures to control for in the analysis, again, to make sure that that wasn't driving any differences that we may have found. But they were not different on the ADOS, so that was great. And they were not different on the parent rated observations of communication, emotion, and social skills. So that was great as well. So they seemed to be more even on features of autism, but maybe the language might be a little bit different. So we controlled for language. And so just to remind you of the pre-assessment, we did those 4 tasks with the kids again. And then after they completed that, they were then randomly assigned either to the intervention or the control condition. So this is what the intervention looked like. It was a series of tasks. They were gaze contingent like the attention tasks are. And so there were basically 3 main areas that the attention intervention targeted. So the first one was a changing target. And I'll play a little clip to show you what some of these tasks look like, because they're quite cute. But basically, you can see there's this visual array, and like the images are kind of like slightly moving to get attention. And then the child will learn that, for example, they have to find this girl. So once they find her, she'll zoom around, and then the image will reconfigurate, and then the girl will show up somewhere else on the screen, and then they look at the screen until they find her. And then after they find her a certain number of times, they'll get kind of a reward with like something really fun and visual happening on the screen. The one that I am showing you is this elephant one. So again, it's the same thing. There'll be like 3 animals here, and the child has to learn that they have to find the elephant, and they learn this rule. like pretty quickly. And then after they find the elephant 4 times, this really like a video of a real live elephant kind of walks across the screen on the video and does something funny with his trunk. So it's visually rewarding. The second type of task that is within this intervention is working on working memory. And so one of the ones I'm going to show you looks a bit more like this one. Basically, what we have is a character, and he's kind of in the center of the screen down here. And then this guy makes kind of like a croaking toad noise, and he'll croak, and then he'll jump in one of these 2 boxes. And then a little thing will come across the screen to remove the boxes. And then the 2 just blue boxes will appear, and the child has to remember where the little character went. So they maintain their visual attention on the screen. It'll shake a little bit. And if they pick the right block, it'll make a breaking noise, and the little green guy will come out and he'll croak a little bit. And then, so that's that one. And this one's a similar type of thing where they hide in 2 objects and they have to remember which object the animal hid behind. And then once they find the 3 objects, they kind of bounce around the screen, and it's supposed to be fun for the kids. And then the third and last type of intervention that they have is called goal maintenance. So I'm going to show you, I believe, the little flyme guy. But what this one is basically designed to do is the child has to fixate either on the butterfly or the little pink flying guy. And as they spend more time visually fixated on we'll say the butterfly here, certain images will come across the screen that are kind of distractors. And if the child looks away from the butterfly to look at the building, for example, everything kind of disappears except for the butterfly. And then they look back at the butterfly, and then the images start to appear again. So it's about helping them maintain their visual attention on the stimuli that's supposed to be the most salient in the image. And so now I'm going to show you an example of each of these. So this is the changing target one. So you can see here, the child is to look for the elephant, or he had just found the elephant here. And so now you get to see what an actual trial looks like. The 3 images, and then you can see it shaking until and then once he finds the elephant, he has to keep his attention on the elephant. And you'll find these games also are really, I'm not sure of the right word. I'm going to go with iterative, where as the child gets better on it, the length of time they have to remain fixated on the elephant will increase as they start to learn the task more. So that was pretty quick there because this was near the beginning. So it's like we want to reward that they got the right target, and then maybe week 2 when they come in, they may have to look just a little bit longer in order for the elephant to appear. And they'll find, like, if all of a sudden the child is not performing this intervention as well, they'll reduce the games, just auto reduce the amount of time to keep them like, this is what you do, like to teach them that kind of rule. So it's really cool how intuitive they are. So the second task, this is the working memory one. Again, you can see the little guy, he's going to pick a thing. You can see it blocks it out, and then the child has to remember. You can see that he picked the wrong screen first and it's shaking. And if after a certain amount of time they don't get it, then it just resets. And you can see this is a resetting here where they're like, no, you struggled with that. We're not going to make you keep going. We're just going to reset the trial, remind you where the guy was, and you get to try again. So there is a little bit of learning that takes place in the intervention. And then as they learn the rules and learn the what they're supposed to do in the task, and the amount of time that they spend fixated on the right window takes a little bit longer. Sorry. And then the last one is this goal maintenance. So what you'll see here is they're looking at this cute little pink guy, and then these distractors enter the screen like a cloud. And then the longer they're able to keep their attention on the guy, a lot more stuff comes across the screen, and it becomes, if you're really prone to distractors, it becomes a little bit difficult to keep paying attention to the flying guy and not look at the distractors. But you'll get to see what happens when the child looks away from the guy. So you can see everything, like his little happy face, the distractor disappears. So you can see then once he looks back at the little purple guy, he gets to keep going with the task. Okay, and then the placebo condition is basically this, like they're all in the same, like the intervention and the placebo condition all take place in the same tent where they did the intervention or the attention assessment at the beginning. So they're familiar with the tent by the time they get in there. So with the placebo condition, the main difference is that it is not gaze contingent at all. So in the intervention, the the stimuli on the screen is responding to where the child is looking and what the child is doing with their eye gaze. In the placebo condition, it's literally just passive viewing of a series of children's British entertainment, because our collaborators in the UK made this, and he's really into British cartoons, I guess. But we would play like a couple different clips, and basically the only thing was if the child started to get a little bit antsy, we would randomly change the movie, or sometimes change the movie to make sure, because we wanted to make sure that the child in the control condition was in the situation for about the same amount of time as the child in the intervention condition. And so the task usually would go on for about 20 minutes. So that's also the average length of many children's cartoons. So we would just flick through these videos just to keep the child, in the same situation for that length of time. And what was nice about flicking through the clips is that the parents themselves also weren't sure what condition their child was in, which helped with the randomization as well. Because with the clips changing and going between different children's cartoons, they weren't sure if that was like the control or if that was a part of the intervention, because it wasn't just a 20-minute episode of one cartoon, but it was not gaze contingent at all. And so after they completed the intervention or did the control condition, we then had them do that same set of 4 tasks again. And then we looked at to see if there was any differences. So we included their score at baseline in the statistical analysis. So on that first time before they did the intervention, we included those scores as control variants. We included parents' ethnicity as control variants. We included scores, the receptive expressive language scores as control variants, because we really wanted to see if any differences that we found was related to the intervention and not due to these other things that could be impacting the scores at this post-attention assessment. And so what we found was with the sustaining attention task, we did find differences. So the kiddos that were in the intervention condition were showing more meaningful sustaining attention on these tasks. So they were able to look at the interesting trials and explore the interesting in the trials in a way that was different from the control kiddos. And this was after controlling for their language level, the ethnicity, and their values at the at the pre-assessment. And then on this joint attention task, again, we were able to find that children, for number of eye contacts, the children who were in the intervention made more eye contacts with the examiner than did children who were in the placebo condition. And again, that was controlling for those factors that I mentioned before. So we are, hoping and suspecting that this is due to them participating in the intervention. Interestingly, though, we didn't find an overall group difference for cognitive control, but when we looked at the performance within the intervention itself, so there could be a difference between, if a child's in the intervention and they never really get past that learning stage, maybe the intervention isn't the right fit for that child. So we were really interested in looking at, okay, how did they perform in the intervention? And did this have an impact on anything? And what we found was an interesting effect with this Peppa Pig task. We found that as the performance, the negative scores are better because it's a subtraction. And so the negative scores are better. And what we found, the kids who actually showed that they were getting the intervention really well and that they were performing and getting really, really far, because as I mentioned, the games were iterative. And so as the child was learning the rules and getting really far in the games, they actually showed an improvement with the cognitive control aspect. So the kids who were getting a lot out of the intervention were actually able to learn these rules a lot faster, which was really cool. And of course, because the control group didn't have the intervention, this is just the kids in the intervention group that would have this data. But again, we didn't find any differences on that gap overlap task. And so what we did find overall with these 2 studies then is that neurotypical and autistic toddlers do have differences on measures of visual attention, at least visual attention in the way that we measured it with these tasks. So we found differences on that joint attention task, which is eye contacting and pointing and then following an examiner's point, and also on sustaining attention. So being able to look at interesting versus non-interesting stimuli, but we didn't find any differences on that gap overlap task or being able to disengage their attention from essential to look at a peripheral stimulus. And we didn't find differences on that cognitive control task. So then when we ran the same type of the task with the autistic kiddos, and then we gave them that intervention, which again, I want to remind you was just 4 weeks in length. We did find that the intervention seemed to have an impact on the two tasks that were different between the autistic and the neurotypical toddlers. So the intervention did seem to have some impact on joint attention, in that it increased the number of eye contacts of the children in the intervention group. And it did seem to have an impact on that sustaining attention group, or sustaining attention task. And then when we looked at just the performance within the intervention, we were able to see that if they got the intervention and were able to learn and do really well in that intervention, that did seem to impact their performance on that Peppa Pig task. But we didn't find any differences on the gap overlap task at all. And so what this tells us then is that technology using eye gaze could be a really good method for measuring visual attention in really young children that present with developmental delays or don't present with developmental delays. And then when we looked at the differences between our autistic and our neurotypical toddlers, we did find some strengths there, right? So we did find that they didn't differ on disengaging attention as we measured it, and they didn't differ on this cognitive control task, which is kind of like an analog to a particular type of working memory. So that was really interesting that they didn't show differences there. So these are attentional strengths, and that maybe could be tapped into to help build those skills that attention seem to be so important for, like communication and academic skills and social, making friends and things like that. And what's also, I think, really important is that the challenges that came out on the joint attention and the sustaining attention were the two things that seemed to be the most impacted by this really short 4-week attention intervention. And I think that is amazing that we were able to show with a short period of time that this intervention could impact it. And it would be really interesting to see, had we had the opportunity to do it longer, if the effects may have been greater. And that is something I think that would be really nice to explore in the future. So I would just really like to thank all of the children and families that participated in these 2 research studies. Without their time and commitment, and especially in that attention intervention one, that was a bit time consuming for families. So we always really appreciate the amount of work and time and care they put into having their children come to all of these things. And I'd like to thank my supervisor, Dr. Lenny Zwagenbaum, and our collaborators on these studies, Dr. Jessica Bryan in Toronto, Dr. Isabel Smith in Halifax, and then our UK collaborators, Dr. Sam Wass and Dr. Mark Johnson, who were kind enough to share their attention intervention with us and to help us set all that up. So we really appreciate their partnership as well. And of course, all the lovely, wonderful funders that helped us and supported us to do this really important research. So, and thank you all for being here today and listening to my talk and my sore throat. I appreciate you taking the time out of your morning to be here. And I'm happy to engage in discussion.